Alright, so we have our orders to place an NG tube in Miss Mannequin here. So we're going to go ahead and collect our supplies. We'll need our NG tube. We're going to need a syringe. We're going to need our lidocaine infused lubricant, which will have to be approved by the doctor. We'll need some pH strips, some tape that I've already prepped, and then we'll go ahead and always start by yelling in. Knock, knock, knock. Good morning, Miss Mannequin. We've got orders to place an NG tube in your body. So we're going to go ahead and get that procedure done. Could I have you state your name and date of birth, please? Perfect. I'm going to go ahead and just check that against your band. Awesome. And then, just question, do you have any known drug allergies at all? No known drug allergies. Wonderful. All right, so I'm going to go ahead and raise you up to just make it a bit more comfortable for me. I'll go ahead and explain the procedure in just a second, but I'm going to go ahead and test to make sure I've got pressure. We've got suction.
So I can just drop
We're all set there. So we're all good to go ahead and get this procedure going. So what we're going to be doing today is we're going to be placing an NG tube, like I said, which is a nasogastric tube, and that's going to go from your nose, through your nose, down into your stomach. The reason we're doing this is to try to decompress your stomach and get some of that gunk out of it, all right? So we'll go ahead and get started. I'm also going to go ahead and collect a cup of water, as well as a towel, and I'll go ahead and place the towel right here. So like I said, this is not a comfortable procedure, but we'll go ahead and try to get it done as efficiently and quickly as possible, and I'm going to need your help while we're doing this a bit, okay? If at any point in time you're in too much discomfort, just go ahead and raise your hand and we'll stop. Or give me a thumbs up just to say keep going, all right? So we'll go ahead and get the tube out, and then we're going to go ahead and measure first. So I'm going to go ahead and take this. We're going to go from the nose to the earlobe. And then we're going from the earlobe down to the xiphoid process, which is kind of like that bottom of your sternum, which you can feel right there. And then we'll go just a bit lower to give ourselves a bit more room, all right? I'm going to go ahead and mark this spot as our destination. We want to go that deep to ensure that gets into your stomach and is not just hanging out somewhere else in the body.
I can also use this as my sterile area as well.
So what we're going to do is we're going to go ahead and take a look
to put under the patient
in
We're not
your
gonna
nose.
Do that.
Have you ever
I'm
had a
just gonna use
broken
it as
nose or
extra
anything, or
space
deviant septum? Can I have you tilt your head back? Perfect.
Field.
No? Okay, but this right
then
nostril will
this
be
little
okay then
drape.
for us, right? Awesome. All right. So let me go ahead and get this lubed up, and it's got lidocaine on it, and that's going to go ahead and just help by numbing the area a bit. Squirt, squirt.
Right there.
All right, and we'll go ahead and get started. All right, so like I said, it's not going to be comfortable. Our first part's going to be going and pushing this until it gets to the back of your throat. And then once we get to the back of your throat, I'm going to have you bend your head down. I'll help you with that. And then I'll give you a cup of water, and you'll take a couple sips just to help this get down there, okay? So go ahead and just try to do your best to get comfortable. It's not going to be, and like we said, raise your hand if you need, okay? You doing all right? Thumbs up? Awesome. All right, do you feel that in the back of your throat? Perfect. All right, so we'll go ahead and bend the head forward. Here's that cup of water. You'll go ahead and take some sips, as you're doing, and just small sips through that straw, okay? We're going to go ahead until we can't go, or until we get all the way down to the tape, but we can't go any further. All righty. Perfect. So now we're going to go ahead and test to see if it's in the correct spot. And we're going to do that. I'm going to go ahead and do that by pushing air and taking a sound to see if I can hear that air in your stomach.
Inject it onto my little plate. Put that back.
All right.
And now with the Foley catheter, I want to use my dominant hand to put it in. So when I get ready, I'm going to spread the labia.
So that means that we're in position.
And I'm going to use
we're going to
my
go ahead and
dominant
just
hand
double
to
check
feed the
that
Foley in.
by going ahead and taking 10 to 15 milliliters of gastric content out. Perfect.
I'm gonna
I'll go ahead and squirt it into our pH cup. I'll take out this, take a look at it, compare it. It looks nice and orange, so we're going to go ahead and say, oh, that's a pH of 4, which means we've got some good stomach juice there. All right, so we're going to go ahead and get you hooked up to suction now.
non-dominant hand, so this hand is non-sterile now, and I'm just going to move it all the way. And I'm going to keep pushing until I see a little bit of urine into the tube, and then I'm going to go a little bit further than that.
All right, and we're going intermittent on green.
Okay, that's 1-4.
Perfect. All right, so suction will start coming out soon. Alright, so this is going to go ahead and
So let's say I see your
remain in
end coming into
place.
the tube. I'm just
We're going to go ahead and get that taped up in order to do so.
And for the putting the caster, I'm going to expose your penis area, and this might be a little
I'm gonna take my
okay?
non-dominant
So
hand and I'm gonna hold it right there.
feel it out.
Alright, Miss
Just
Mannequin.
let me know. I will
Get
stop
that
right away.
nice and secure.
So, yeah, before we
Into my
cleaning,
little water spout right
That'll
here.
stay right there. We'll go ahead and just clip this onto your shirt, and that's going to stay in place. So don't tug on it at all. If you need anything, please let us know. We can help adjust or do something, but it's set in place right now. We don't want to have to do it again, so just try to leave it there and not mess around with it. So you're all set. That's all we need to do today. I know it's uncomfortable, but in the long run, it might take a couple hours, but everything will feel better with this on, all right? You have your call light. Are you all set? Anything else I can do for you today?
I will get 6 and then
All right. So then I'll go ahead and leave. I will remove my equipment, throw it in my trash, take my gloves off,
Right there.
toss those, perform hand hygiene, and document that it has been placed.